everybody. This is Dr. Ladd McNamara, and it's Monday mindset time, and it's the Thanksgiving week, so happy Thanksgiving week. Today I'm going to talk about anxiety and tips for coping with anxiety, some coping tips there. Who doesn't have anxiety from time to time, right? Anxiety is kind of a part of life and part of living, but how do we deal with it? Sometimes it can be incapacitating to the point where you just feel like you can't move. And certainly that's a serious problem. But when we talk about some of those anxiety and what causes it, there's a very, very common underlying things that will cause some stress, and then stress goes on to anxiety. But let's talk about this. Finances is probably number one cause for anxiety for many, many people, because many people experience financial situations where they have that. Well, personal relationships, of course, who hasn't had a personal relationship that didn't have anxiety? But when things are not going the way you want to go, and we're not just talking about just occasional stress or frustrations, but the anxiety that can come up and creep up and can be crippling sometimes when you're not sure about what's happening there. Work stress or school stress, deadlines can cause anxiety, or just the amount of work that has to be done in a short period of time can be overwhelming. So when we talk about stressful situations and anxiety, they're two different things. Anxiety is a non-helpful way or non-helpful condition to response to stress, and that's what I'm talking about here. Medical issues, whether you have some medical issues that are going on in your life or in someone else's life, that can be a problem, can cause an anxiety because, or even just thinking that you might have a problem, but it's very stressful and anxiety provoking. Medications. Certain medications can provoke anxiety in and of themselves. Like sometimes birth control pills can cause anxiety in women, and there are other medications that can actually trigger anxiety. Caffeine, again, don't have too many Rev3s because some people may be more susceptible to anxiety issues, let alone the fact that you might not be able to sleep well if you get too much caffeine. Or coffee, or any source of caffeine can trigger anxiety. And not skipping meals can cause anxiety. You get hypoglycemic. So especially when you're on a high glycemic diet, in other words, you're eating high sugary, high carb foods, you have this rebound crash and your blood sugar goes low. That hypoglycemia can then cause a feeling of anxiety. Lack of sleep, your mood's not stabilized, and you're haven't had that good dream state, restorative sleep. You're sleep deprived, and then that would lead to anxiety. Anxiety can then cause insomnia. Insomnia and stress can then lead to anxiety. In other words, it's a spiraling circle. Anxiety leads to insomnia. Insomnia leads to more anxiety. So it's a spiral out of control. Negative thinking. Negative thinking is a problem because how you think, it affects your mood, not the other way around. It's not you're in a mood so you think differently. It's the thinking is always starts that off. And negative self-talk. Social events like you're going to a party, let's say, and you don't look the way you want to look, or maybe you have too much weight on, and you don't, you're stressed about what you're going to wear, and or just having to put on the event and having to deal with people, having to talk with people, and figure out what to talk with. Some people can cause a great deal of anxiety. Or how about public speaking? They say that sometimes some people fear that more than anything. That public speaking or public performance can be very anxiety provoking. A lot of actors might have that issue. They'll be taking some medications, usually a beta blocker, to deal with those anxiety issues. Beta blocker is like propranolol. It's a medication for that just singular event. But again, we're talking about anxiety that can be just chronic, ongoing, that can cause problems on a day-to-day basis or several times a week basis. Certain traumas emotional traumas, PTSD, post-traumatic stress disorder, or any other emotional trauma that could have been in your life or going on currently in your life. It doesn't have to be a post-traumatic. In other words, it doesn't have to be something long-term, ways away, but it could be going on now. You could have emotional difficulties. A death in the family, very anxiety provoking, or upcoming death, or somebody is in the process of dying. Somebody can have a lot of anxiety about that, or even your own possibility of death. after this. And of course, many people have the comfort and the faith that they have. Health declining, symptoms, a symptom pops up like, oh, you feel something, or you feel a lump in the breast, and all of a sudden you have anxiety there. Lack of oxygen, simply being in a hypoxia, low oxygen environment, make you feel like you're suffocating, can be anxiety provoking. Or when you go into high altitudes, being from sea level here in San Diego up to the high mountains, Rocky Mountains in Utah or Colorado, it can have a relative change there. Also, certain coming off of drugs and alcohol, when somebody's been using drugs or alcohol for long periods of time and then they stop, they could be feeling a lot of stress and a lot of anxiety because they've used the drugs or alcohol to numb themselves out, and they haven't really had an opportunity to be able to deal with those events or emotional events that are going on in their life. And therefore, small things can cause a lot of anxiety, and not just the events that go on, but it's also inherent inside them. There's actually the hormones in your brain are off. The mood enhancing hormones like serotonin and dopamine can be off, and it can then trigger some anxiety or uncertain future, not know what's going on. So you may know already what causes anxiety in your life, and you might be dealing with some anxiety. So how can you recognize it? The symptoms of anxiety, sometimes you just worry or have fear. You can have increased heart rate. You also notice that your heart rate's going off and you're breathing heavily and you're not quite sure what's happened. You just feel like sometimes anxiety can be so bad you feel like you're dying. That's how anxiety can be. It can be crippling anxiety. Again, there's levels of anxiety, just feeling just of worrisome and fear anxiety to the point where you literally can't function and you're on the floor just hyperventilating because of anxiety. Irritability is a kind of sign of anxiety, restlessness, as well as insomnia, not being able to sleep. I mentioned earlier, or having muscle tension, constant neck strain, or any other muscles going on, strain in your back. It can be just for the fact that you're anxious and you have your shoulders hunched up, and so you continually have a neck ache or a headache because of that muscle tension. Lack of concentration. Who can concentrate when the anxiety is going off, when they're worried about things? And it can be so overwhelming, anxiety, that you can't even focus on anything you're doing. So the lack of concentration is there. Physical discomfort and chest pain is a very common thing. People can feel chest pain to the point where they think they're having a heart attack. They go into the emergency room, and the doctor will say, "No, you don't have signs of a heart attack. It's anxiety." And they say, "Well, no, it was really bad." And they said, "Yes, I know." Chest pain can be very severe. It can feel just like a heart attack, and it can be 100% due to anxiety. It's not just in your head. You actually feel it. Well, how do you cope with it, right? The coping strategies, how do you cope? Well, you can identify the triggers that provokes the anxiety, have an awareness of it. You can journal about it and get professional help. Well, that's professional help. That's certainly where you might need prescription medications like the beta blockers or other medications. But if you're at that level, certainly seek a health professional. We're talking about some other levels here, what you can do. Certainly you can have awareness of and journal about it to find out what your triggers are and find out just to be able to work through some of those issues. What helps deal with anxiety really is understanding the anxiety, what's causing it, what's coming from, what's going on in your life, and then getting some kind of control over that. Now, when I say getting some control over it, some things you cannot control. You can't control if somebody died and you have anxiety about that they died and now what's happened in the future. You don't have control of that, but you have control of how you can react to it and what you can do about it. So here's the control that you can take. For example, let's look at money. Since finances are an issue for many people and they cause a lot of anxiety, particularly as we're approaching the holidays and spending goes up. Here are some ways to cope with it. You can increase your income. You can get a part-time job, or you can do a home business. Some of you are doing those home businesses and you know that well. You can decrease your expenses. You have control of that. And then, of course, being a better management. Getting on a budget sometimes helps. If you're not on that budget, that can sometimes create a lot of anxiety because you don't know what kind of money is coming in, what money is going out. So what are these things, one or two? What does it come down to? What does that mean? What do all those things? This means two things: understanding the finances, understanding your budget, and then getting control of it so you can make changes in your life if you can. But even if you can't control it, if you're unable to control the things that cause anxiety, having an understanding of it is very, very helpful. Many times when you're anxious about what's going on in life, not sure what to do, you can make a list of things. And once you make a list of what things that you need to do, you realize that that list may not be very long. It may feel like, oh, I'm so overwhelmed with things, I can't even focus. Make a list, and maybe there's 3 things you really need to do to solve the issue, to get under control. And it's not a list of 20 or 30 things that you're continually ruminating about and going around and around in your head, where you're sleeping, trying to sleep at night, and you're just thinking about all the things you need to do, and the anxiety is keeping you awake. You realize once you kind of write it down, put it on a piece of paper before you go to bed, what are the things you need to do? You can then get it out of your head onto the piece of paper and then think, okay, I don't need to think about this as I try to sleep. That's on a piece of paper. I'll wake up in the morning and we can be anxious about it again, but hopefully you won't be. Decreasing stress in your life will reduce anxiety significantly. Identifying those factors that lead to stress, changing what you can, and coping with what you cannot change. Very common things. And again, it's not about the stress that's in your life. Everybody has stress. It's how you deal with it. It's how you respond to that stress. And that comes down to your mind, what you think about it. As a man thinketh, so is he, right? If you think you can, you can. Your thoughts are what create your feelings about things. You don't have feelings and then thoughts. What you think about things is everything. So your thinking creates your feelings, and then the feelings that you have then create your mood many times. Well, change the self-talk. There's a lot of great help for self-talk, a lot of great resources for self-help and self-talk, and many of you know those already. You can change the self-talk and change your thinking. What I'm going to get to more quickly anyway, is what you can do with supplements. But I wanted to go over a few things here. You decrease anxiety. In other words, you change your mood. You change your mood, the anxiety will decrease. Positive thinking is key for changing anxiety. If you don't change the thinking process, the thought process is that rut. So every time you think of things, you're creating a new rut. It's kind of, just think of it, you're just create a new rut as you go back and forth. If you march back and forth on a grass lawn and go back and forth in one area, the grass is going to die, then you're going to have a trail there. So then you just create a little rut. And if you don't change that thinking, that rut will never change. You've got to be able to not just stop thinking about it, because nobody can just stop thinking. You've got to change what you think. You've got to think differently. Lifestyle changes, and we'll get to that. And then supplements or medications. Hopefully you don't need to go to medications, but if you need to go to medications, hey, that's sometimes is necessary to deal with it if it's crippling anxiety. But many times, the positive thinking, the lifestyle changes, and the supplementation is enough for most people. So what kind of changes in your lifestyle we're talking about? Dietary changes, eating more healthy, in a healthy way, or healthful foods, low glycemic foods, so you don't have that spike and then the following resultant hypoglycemia. Eating organic foods, so you don't have these preservatives and other things they put in foods that sometimes can affect your mood and thought processes. It really does make a difference. Exercise is huge. Not only reduces stress, but also reduces anxiety and depression. Anxiety and depression usually go hand in hand. Getting better sleep and staying on a sleep schedule. Exercising sleep hygiene is very important, because if you get into a good pattern of sleep and regular sleep and near the same time you go to sleep, it will help improve the mood as well. And supplements, that'll affect your mood. So this not only helps your thinking, but the actual hormones, the mood enhancing hormones in your brain will actually function better and be able to function on your feelings and your thoughts much more easily. I mentioned those mood enhancing hormones, or two of them earlier, which is serotonin and dopamine, and another one's GABA. Those are the 3 main mood enhancing hormones, the ones that have an effect on us. So what can we do to help us change our lifestyle, to help this mood enhancing hormones with supplements? Well, some supplements we know that the B complex vitamins are known to help with mood because vitamin B12, vitamin B6 is integral important in being able to generate, for the body to synthesize some of those mood hormones. Probiotics, the gut and the brain connection, the serotonin is boosted up simply by getting the right probiotics. Taking probiotics daily can be helpful if you're dealing with anxiety and stress. Boosting up vitamin D, vitamin A, vitamin C, vitamin E, all these have been shown to affect anxiety, mood, depression in a positive way. A deficiency of nutritional supplements, of micronutrients, is also associated with increased anxiety, stress, and depression. Magnesium is important, increasing magnesium. It helps not only just your muscles relax, your mind to relax, but it actually helps with anxiety as well. Fish oil, particularly not just any omega-3 fatty acids, but the DHA in the omega-3 fatty acids in the fish oil has been beneficial with anxiety, depression, and stress. Bacopa, Bacopa monnieri, that many of you have been familiar with it since summer, and also American ginseng, as opposed to Korean ginseng, which can amp you up. American ginseng has more of a calming effect, reducing anxiety. Put these two things together, Bacopa extract and American ginseng, it can be very helpful in reducing it. Rhodiola is a herb that's very helpful as well. Some of you might have that in a little powdered packet drink that you can use in the morning. Other ones, 5-HTP. 5-HTP is a 5-hydroxyl-tryptophan that is a precursor to making serotonin. Your body takes in tryptophan and it converts it into 5-HTP, and then 5-HTP is converted into serotonin. And vitamin B6 is needed for the conversion of tryptophan into 5-HTP and 5-HTP into serotonin. That's some of the things that are important. So 5-HTP, and it's not only found in your brain normally, but also you can supplement with it. L-theanine, it's from green tea, a green tea extract. GABA, ashwagandha, it's right there. Can you read that? Ashwagandha. Okay. Anyway, that one. Lemon balm extract. I'm just naming off a few that can be beneficial. Chamomile, kava, lavender, St. John's wort. St. John's wort is particularly helpful if you have anxiety associated with depression, not just straight anxiety. Valerian root, passion flower, CBD oil, that's also been shown to be helpful. I summarized on this piece of paper, so let's go to this. Here's what I'm suggesting for anxiety support, for nutritional support. All right, there's not a treatment, cure, anything like that, not making any claims. I'm talking about this is how to support for better mood. To support your mood, enhance your mood, again, check with your health care provider before you initiate any herbs or vitamins or supplements for any situation you might have. So there's my medical disclaimer. But as far as I'm talking about, things that support better mood. Foundation of good vitamins and antioxidants and minerals, very important. All those things help with it. Higher oxidation in the brain is associated with more anxiety. So you want to reduce that with antioxidants. Plus, directly that helps. Fish oil, I mentioned already. Additional vitamin D, increasing the vitamin D on my website, labmcnamara.com. I have how much should you dose with vitamin D? I usually suggest at least 5,000 I use a day, at least 4,000 I use a day, if not up to 8,000 or 10,000 I use a day. Extra magnesium. Taking a couple extra magnesium, and it comes with calcium and vitamin D, great. 2 to 4 extra magnesium tablets along with your minerals be helpful. Probiotics, you're dealing with anxiety, so just maybe consider probiotics daily, not every other day. Coenzyme Q10, did you know coenzyme Q10 also, the studies have shown that is beneficial in helping to support people's mood who are dealing with anxiety. Oh, some of you might recognize some of these micronutrients from a liver support product, but curcumin, olive extract, alpha lipoic acid, don't have my glasses on, N-acetyl L-cysteine, broccoli extract, green tea extract, decaffeinated green tea extract. All these things have been shown, the medical studies have shown there's benefits with anxiety. So melatonin also, both directly and indirectly. So indirectly by improving sleep, quality sleep, restorative sleep, melatonin can help you with mood. Directly, melatonin also helps deal with anxiety. So taking up to 5, 6, 8, 10 milligrams at night can be very beneficial. It makes you drowsy, so take it at night. Oh, the other things you can do. Oh, Bacopa. I already mentioned Bacopa extract with American ginseng. Very helpful because, particularly if you're feeling overwhelmed, a lot of times people have anxiety when they're feeling overwhelmed or have um, been overwhelmed, so therefore they have anxiety. The American ginseng is very helpful in that reducing the feelings of being overwhelmed. Additional 5-HTP, you can add that to it. Oh, I mentioned the drladdvip.com if you want other resources. I know I went over those things fast. The main point is this. Most people feel stress from time to time and have anxiety from time to time. Other people are dealing with chronic anxiety or situational anxiety that might be going on for days, weeks, sometimes months. It doesn't have to be that way. You can take control of it, whether it's taking control of our finances, doing some relationship issues, or whether it's just any other changes in your life. But by making lifestyle changes, healthy lifestyle changes, with eating, exercise, sleep, and nutritional supplements, you can feel better, have a better sense of well-being and a better mood. And if you have that, then you're not dealing with anxiety, are you? Well, hopefully you can have that mindset today, have some positive thinking that you can do it. Things will be as they should be, and you have more ability to change your circumstances than you ever thought possible. And with that, I want to say thanks to everyone. Have a great week. Happy Thanksgiving to all of you. And I'll look for in the comment sections later for any comments, and I'll answer them there. All right. Thanks.